Okay, so welcome to our next little discussion here as we talk about in this analyze chapter of our lower backs program. And this is something I really want to, it kind of goes off of where we were just discussing, and we were discussing doctors and how valuable it is to go and get those tests and how it is good to learn as much as you can about your situation. Okay, but now I want to kind of take it to the next, logical progression here that says, okay, so you've gone to your doctor if you wanted to, and you got your test and you got your analysis, and that's good. And now I'm going to say, at that point, now it's really probably time to recognize that it's unlikely that they're going to be very helpful from that juncture, okay? So where is the medical world going to be very helpful? In information, in imaging, in getting, tests done and figuring it all out, so to speak, and giving some analysis. That's fine, no problem. Let them do any diagnosis that they want. But when it comes to how to take you from where you are at that point to become pain-free, well, that's where we're going to want to really, really take a real good look at what's going on, okay? Because, getting information is one thing, but then once they've given you the information, the suggestions that they are often going to be delivering are extremely suspect, suggesting us that we go and become pain pill dependent, suggesting that we go in undergoing intensive invasive surgery, suggesting all of these things that are really not going to give a pain-free life of well-being. And my point here is, and I think it's really important that you appreciate my perspective here, is that the medical doctors, when it comes to helping or treating your back pain, are really not very good. But what they are very good at doing is testing and giving you information and allowing you to kind of have the knowledge that you need to move forward. But that doesn't mean you're going to move forward under their guidance, because guidance of taking pain pills and guidance of getting surgery, which oftentimes makes matters worse, this is guidance that really we're going to be avoiding. Okay, and that's, of course, why you're in this program, so that you do not have to go down that route. Obviously, likely people have been telling you that that's what you have to do, that you have to go to surgery, that you have to, become a dependent on painkillers for the rest of your life, because otherwise you're not going to be able to function. And you've probably realized that, that's not a good enough answer. That's not going to work for me. And that's why you're here, and now you realize, and you're going to realize more and more that you really have made a very, very intelligent decision, because you're going to be pain-free, you're going to be drug and painkiller-free, and you're not going to ever need surgery ever. Okay? So again, to kind of review, I have a lot of respect for the medical paradigm in certain contexts. But in others, I think that there's a big limitation, and I think it's important that we use the medical paradigm for what they're best at, but that we are able to apply other systems which are more effective and that do not cause dependencies and do not cause traumas as a result of invasive procedures. Okay, so that is this small lesson, and now from here we're going to get into analyzing our back pain and seeing if we can figure out within our own context what's kind of going on, assuming that we're not going to get real specific tests involved. See you at the next lesson.